Guys, welcome back to my channel, The Dentistry Girl. We are back with a new topic. But before starting my topic, I want to tell you that after a long time, I will continue again because I had to take a break in between due to my exams and practices. But for now onwards, I decided that I would upload at least 1 to 2 videos every week so that we can thoroughly clear each and every topic as easy as possible. So, without wasting any time, let's start with our topic now. So, our today's topic is skull. So, basically, what is skull? Skull is the skeletal of head. Okay, it is consists of several bones that are joined together to form cranium. Skull is important for the theory as well as for the practical purposes as its markings are always asked by the examiner during spotting. Skull is made up of two bones. First one is cranial bone and the second one is facial bone. Cranial bone forms upper part of cranium whereas facial forms rest of skull and mandible. Okay, moving towards the bones of skull. As we already mentioned, there are two types of bones, cranial bones and the second one is facial bones. Cranial bone surround and protect the brain whereas facial bone forms eye sockets, nose, cheeks, jaw and other parts of face. Okay, they are again classified as paired and unpaired. So in cranial bones, paired have PTMIS. You can also use other mnemonic so that you can remember their names. So for paired, P stands for parietal, T is for temporal, M stands for malleus, I is for incus and S is stapes. Whereas unpaired have frontal, occipital, sphenoid and ethmoid. Actually, some of the books mention that cranial have 8 bone and facial have 14 bones, but here I took content from BD Chaurasia latest edition in which they mention that both have 14 bones. So for facial, paired include maxilla, sorry, yeah, for paired, M stand for maxilla, Z is for zygomatic, N is nasal, L stands for lacrimal, P is for palatine, I is inferior nasal conche. Unpaired includes mandible and vomer. Paired are 2 in numbers and unpaired are 1. So when we add them, then cranial have 14 as well as facial have also 14 bones. Okay. So moving towards norma verticalis. What is norma verticalis means? It means we viewed our skull from above in which skull appear as oval in shape. So here are the markings. F, this one is frontal, both are parietal bones. Orange one is occipital. This one is coronal suture. I write sutures in green color. This one is sagittal suture. This is lambdoid suture. This point is bregma. This is lambda. This one is oblivion. And these 2 points are referred as parietal foramen. Now norma frontalis, when we view our skull from the front surface, this one is frontal bone. This is parietal bone. This pink one is temporal. Yellow one is sphenoid. Green in zygomatic. This one is maxilla. This is mandible, which is most important. Now this one is nasal bone. Okay. Now norma lateralis, I had already written some of them. So for here, this are zygomatic, maxilla, mandible, parietal, temporal, occipital. Now this process is styloid process. This bone in pink is mastoid process, and this is the external auditory canal. Okay, this is normal basilis when we view our skull from the basal surface. Okay, so this one is maxilla, this is palatine bone, green in zygomatic bone. This yellow one is sphenoid. This one is vomer. This is external auditory canal. This is mastoid process. This bone is occipital bone. This is temporal bone. This is foramen magnum. And these two are occipital condyles. Okay, moving towards norma occipitalis. This is when we view our skull from behind. Then they both are the sagittal suture and lambdoid. This one is parietal bone, occipital bone. This point is astrion. What is astrion? It is formed at the junction of the occipital bone, temporal and the parietal bone. This one is mastoid process. Now this is superior knuckle line. This is inferior knuckle line. And this one is highest knuckle line. So that's it for today. See you in the next video. If you found it useful, then do like, share and subscribe to my channel. Thank you.